We're at the offices of thegentlendentist.com. We're in Shelby Township, Michigan, and right now we are going to be asking a patient a couple things about her smile, some things that I had found out and when we did an analysis, and that we're going to do today. So when you had a question, when you came in and we first started looking at, you said you wanted some things changed in your smile. What were those things?
I wanted my teeth lengthened because I felt like they were preschool teeth, like a little toddler's teeth. They were just too small.
Okay.
For an adult smile.
Too small for an adult smile.
Mm-hmm.
Yeah. And so what we did was we talked about that, whitening your teeth. We're going to end up doing veneers on you, but to prepare some things for the veneers, what we need to do is we have to make sure that the gum tissues are all in the corrected place. When we lengthen teeth, we can either lengthen them from the edge to make them look longer, or we can lengthen them from the gum line area and actually bring the gums up. So what we're going to do today is we're going to do a procedure where we're going to actually remove some gum tissue away and do what's called a smile lift. Remove a little bit of gum tissue away, and to do that first process, we're going to show her what actually is what it can look like before we even begin. So let me go ahead and sit you back here. And so what I did was, before we started, we took some impressions of her teeth, and then we made these little temporary veneers of her teeth. And what I'm going to do here is, you come in a bit. What I'm going to do here is just put these on her teeth, and we can kind of get an idea of what that looks like. So right now I'm just going to add a little bit of some binding material in here and do that, and we're going to add a little bit to this. These are just something real quick. We'll be able to pop these off, but we're going to get a preliminary idea of what her teeth could, I mean, just the length of them basically. So we're just going to harden it up with our curing light here, and this is a light that hardens the materials up when we do it. What's real exciting about this treatment is it's very predictable. Then she can see exactly what we're going to do things like, and then when I return, we'll go ahead and show what it looks like when the gum tissue is, a little bit of that gum tissue is removed. So let me set you up, and I'm going to give you a little mirror. There's a little mirror in here, and so just go ahead and, now the teeth are not the right length. Yeah, these aren't really like, they'll be similar to that, but what I want to look at here is where the edge of your gums are. Can you see what that would look like here? When you smile, they're going to be up further than they were. Before, they were down to about this level here, where they look small. So now we want the ideal, these are a little bit long here, the front ones, but we're going to lengthen these and then lengthen these too. But right now I'm just looking at the very edges of them here. And we want them to be about 10 millimeters long. So what do you think about with kind of what, not what the edge looks like, even the color, but just the length of how those are? Do you like that?
Pretty good.
Pretty good?
Yeah. So
we didn't numb you up or anything yet. And so you could give a big smile? Yeah, so go ahead and give us a big smile if you can. Can you come in close with that? And so now you can see there's just a little bit of area there that things are healing up, and her gum tissue is definitely, I'm just going to put a pair of gloves on here, but the gum tissue is definitely back there, and now look how much longer her teeth look like, and it's going to be perfect for you when we do her veneers. So what do you think about that?
I love it.
You love it? It's a good start, right?
Yes, it is.
Why don't you tell us a little bit while we have a second. We also did some bite adjustments in your mouth, because I noticed that there was some uneven wear in your teeth. How was that for you? What was that like?
It feels really good. My jaw feels better.
What were your problems you had with your jaw before?
I don't know, just when I clench them together, it just feels right.
Okay. So it feels more even. And that kind of thing. Okay, great. Okay, well, thank you. Appreciate your time and your and this is Dr. Antelak again, and we're back 3 weeks later ready to put Encrola's veneers in. And so we're going to take off the temporaries, and then after we take those off, we're going to put those on and make sure she likes how they look first before we do anything to place them in. So we'll do that. Okay, it's ready to play. So what we're doing here is we're doing a try-in just with these. These are just laying right on top of the teeth. And how do you, at this point, do you like Like how they look?
Yeah, I do.
Okay. Yeah, take a look at that. If there's anything we want to change now, we can do that. And once again, these are just right now at this point, just sitting right on top of the teeth. And so we'll be gluing these back on. So, okay, very good. Okay, so these are the veneers. These are what veneers are up close, and it's going to show how thin these are. It's a very thin shell of porcelain, like we described before, and so they look like this, and they're just added to the teeth, very, very thin. And so what we'll do is we will go ahead and we're going to cement these on. We just pop their temporaries off pretty simply, and so this is Dr. Anilak again, and we are just finished up, and we just cemented these in for her and finished everything up, and they look really natural. What's your thoughts?
I love them.
You love them?
I just love them.
Yeah, and they look really, really natural.
The Hollywood smile.
You got
I
the
was
Hollywood
after.
smile. And come back with that. And so here was the question. We first started off. There she is, 20 years younger, right? There you go. Good. So we're excited about that, and we created everything for function, and we did the crown to start off. We did the lengthening of the teeth in the front, and got a really nice job. And in the lab, who did this is Ramsey Dental Ceramics, or out of Novi, Michigan. So nice and local. So this is Dr. Anilak signing off for another beautiful case. Thank you.